Let's talk about drains and breast reductions. So this paper popped up on my Deximity feed. It was just published in the Annals of Plastic Surgery, and I think it's worth a read. One of the most annoying things as a patient is dealing with drains. So they're these little tubes that we put inside of you. They come out of your skin and they have a little receptacle that looks like a grenade at the bottom, and they drain fluid. They're gross, they're annoying, they're painful where they come out of the skin. Obviously not fun. So surgeons have thought drains are helpful for a few different reasons in all different types of surgeries. So in general, we think that they drain fluid so it doesn't accumulate, both clear body fluid and blood. And so a collection of blood is called a hematoma. A collection of clear body fluid is called a seroma. And so if you have a drain in for a few days, these things will be prevented. Now, we'll give you criteria, we'll measure how much fluid comes out, and then at some point the drains come out because your body can process a little bit of fluid. But the best studies we have show that they don't prevent those things. Now, the other two reasons people think drains are helpful is because there is a belief that they minimize infection, because as draining the fluid out, it's not a place where infection can live. And then also, there's a lot of surgeons that think their patients have less pain because they believe that the fluid accumulating is a source of pain for patients. Now, to this point, there has not been a prospective trial. It's not been randomized looking at drains. We just really have these retrospective reviews where we look at patients that have had reductions and compare complication rates for those that have had drains versus those that did not. So this particular paper is also a retrospective review. They looked at patients with and without drains, and they did look at the demographics of the patients as well as their measurements and how much tissue was removed. And what they found is that drain utilization did not significantly reduce hematoma, seroma, or necrosis, but drain use did significantly increase infection. So this study is another retrospective study showing the same thing, that drains really don't prevent what we thought they were preventing. So the best evidence we have right now is that drains are not helping our patients in breast reductions. Now, this just reinforces my practice, so I personally won't be changing anything because I don't use drains in breast reductions. But I do think people that use them should really consider not, because we don't have great evidence that they're doing anything. So I'm going to continue hating on drains. I'm using them less and less in all different types of surgeries. My one holdout is still my reconstructions and capsulectomies when there's an implant in place. But I am open to changing my practice there too if the evidence supports. So if you had drains, let me know how awful they were, and hopefully we can convince some of my colleagues to stop using them in reductions.